And from my own personal perspective, as I said, I put a fair amount of time and energy into fighting to try to improve the situation. I'm a general internist, and there's a national shortage of general internists, and I knew that going into all of this. So to educate about that and to try to improve it. But after, and in fact, my activity goes back longer than 2 years, but over the last year and a half, I've been really focusing for the salaried specialists in this province. And at a certain point, you say, the government is resolute, and they've been pretty clear and without any movement on this for months. And at some point, you have to start to move from fighting to stay to making plans to leave. And you have to understand, for physicians, it's not like we can stop working tomorrow and leave tomorrow. We have to make contacts with other places and start to negotiate in earnest. So at some point, we kind of realized that the negotiation here was pretty much over, and the negotiation for job offers from elsewhere was where we should put our focus. And so there are many in this group that are considering offers that are coming, because we're all needed across Canada.
But I guess I'm just wondering, the government's just announced they're going to respond to 130, Ministers Kennedy and Marshall. Is there anything that they can say or do that would get these 13 resignations to be rescinded? Because we've seen similar situations with gynecological oncologists where they submitted their resignations and then there were salary increases made and a lot of them withdrew their resignations. Is there something that the government can do here with this group? I know they're across a series of specialties that would cause you to reconsider, or is it simply too late for that?
I'm not sure if we know the answer to that. We've been waiting a long time for government to sit down with the NLMA and have some real conversations and be respectful of doctors and work together with us to improve the system that healthcare is in this province. And we have met with closed doors and, on some occasions, very rude behavior. And that just has not led to cooperative moving forward. I think what the government needs to do, whether we stay or whether we leave, whether anybody stays or leave, is to work with doctors in an open, honest relationship with respect so that we can move forward on these real important issues of patient safety and patient care. I am the president-elect of the Newfoundland and Labrador Medical Association for as long as I remain a physician in Newfoundland. And I am committed to continuing with that position until I'm no longer a physician in this province. I attended one negotiating meeting in about 6 weeks ago where the Minister of Health left after 20 minutes after being extremely rude to everyone in the room, and I was in shock. I had never experienced this before. In any environment where I've worked collaboratively with other healthcare professionals and administrators, we're all working towards a common goal. And I think the best thing the government could do, and the wisest thing the government would do, would be to treat physicians and the NLMA and our director with respect and say, let's work together to improve the healthcare system of Newfoundland and Labrador. I think that's all any of us want.
You've all talked about patient care and the impact the shortages and the inequities and the inability to recruit has had on patients. How does this help patients? 1/5 of the specialists at the Janeway are going to leave. Key medical professionals and with academic positions and managerial positions are all going to leave. I don't understand how this helps patients.
If I could just relate a personal story, because and trust me, I don't dream a lot, but I've been having this probably anxiety dream because I feel that there's too much coming at me. And I'm in this dream, I'm in some kind of, almost like this, a tribunal where they're saying, Dr. Trahi, did you know it was too much? Did you understand that there was a possibility of making a mistake because of the demands that are being placed on you? Did you think that you could miss this? And, you know, the answers to those questions was, yeah, it's getting to be too much. So if you stay in that situation and say, gosh, is there something on my desk that I'm missing? Or is there something happening that I'm not aware of just because I'm just trying to tread water? Then at that point you say, you know, what would your patient expect you? If you knew this was possible to happen, why didn't you stop? What forced you to keep going? So what's best for patients? I agree that this is not the best option, and my patients, many of them have spoken to me about this, and they're sad about it. But how are we going to make it better if what we get is, this is it, if you don't like it,
Leave.
if you don't like it, leave.
Has that actually been said to you, that phrase, if you don't like it, leave?
Not in those words. I will say that, and I was a fee-for-service physician for the first 8 or 9 years of my practice, and the very first correspondence I got from a government official was, if you don't like it, go fee-for-service. And I'm like, oh my heavens, they mustn't understand. I went from fee-for-service to salary to stay in Newfoundland and Labrador. That was my first decision 10 years ago. So if they're saying that to me, they don't understand my work, they don't understand my patient care, they don't understand the challenges I'm facing, because to tell me to go fee-for-service means leave. Because that's in 1999 I said, if I stay fee-for-service doing the kind of patients, seeing the kind of patients I see, I'm going to have to leave the province. What are my options? I'll go salaried. So to say that, it was like it or leave. And then I said, that's what really said, oh, I have to start educating. They don't understand. It was my initial kind of naive reaction. And that was when it began. And you know, we have done media about this before to educate the public as well, to understand we're not doing this to put you at risk. We want help. We want well-qualified people. We want to have competitive incomes. We don't want to be told over and over again, we understand that you're working at over maximum, but unfortunately we can't get anyone to come.
So, Dave, to sort of answer your question a little bit more directly, what we're hoping to achieve is that, okay, so if all these physicians leave the provinces, which is what I believe is going to happen, the government will be forced to pay attention to some of these services. And one that comes to mind right now is we've got a pediatric ICU that's being really run by 2 physicians with some extra help from a cardiologist. So those women are doing 1 and 2 call many, many nights, and one of them is resigning. So once she resigns, there cannot be pediatric ICU care in this province. Those children will have to be flown out, and then maybe someone will finally take a look at that situation and say, you know what, we need a nationally competitive salary to staff that ICU. And it just seems that there's no other, you know, the government is aware of where these empty positions are, and just nothing is being done, and people are working themselves to the bone and really getting nowhere with it.
And to add a little bit of complexity onto the fact that we have a 2-tiered system, and that is frustrating in itself, is that, of course, we now have new people coming back to fill some positions, and they know that there's 2 different salary scales. So some of those people, quite rightly, are asking for the higher scale. So we very shortly will have the situation where we will have specialists working side by side, one of doing the same job, one of which making the higher salary scale, and one of which making the lower salary scale, because, of course, anyone coming back is not going to come back for a lower salary scale if they know people are making the higher. So if they ask and if they demand enough, I would imagine they should rightly make the higher scale. So it's not only, you know, 2 distinct groups, but that the water's getting even muddier, because now we have new specialists coming back saying, hey, wait, you know. So you could have the situation where you have people working side by side doing the exact same job, making 2 different salaries.